All right. Welcome everyone to our 20th business breakdowns with Sanuwave Health. Before we get started, I want to remind all participants the purpose of this presentation is for informational and educational purposes only and should not be construed as a recommendation to purchase or sell any security. Microcap Club is not a registered investment advisor. Microcap Club, its partners, members, subscribers, and affiliates may or may not hold positions in one or more of the securities mentioned on this program and may trade in such securities at any time. Do your own due diligence and seek counsel from a registered investment advisor before trading in any security. I want to thank the Microcap Club community for tuning into this business breakdowns conversations with Sanuwave Health Chairman and CEO Morgan Frank. Welcome, Morgan. Thanks for joining us today.
Hey, Adam, thanks for having me.
My tag team partner for this business breakdowns is Sebastian Krog. Hope I'm pronouncing that correctly, or Krog.
Yes.
Correct me if I'm wrong, Sebastian.
No, it's fine. Thank you. Thanks for being here.
Sebastian is a private investor and the founder and editor of Treasure Hunting newsletter on Substack. If you're interested in learning more about Sebastian, we'll put a link in the show notes to his work. And Sebastian, it's also an honor to have you on the Business Breakdowns. Welcome.
Thanks. Happy to be here. Thanks for the invitation.
The business we are breaking down today is Sanuwave Health, which trades on the NASDAQ under the symbol SNWV. Sanuwave was originally profiled in 2024 by Ian Castle. Sanuwave is a medical device company that markets UltraMIST, a low-frequency, non-contact, non-thermal deep ultrasound system used in the treatment of complex and non-healing wounds. UltraMIST is an FDA-cleared product that has Schedule I CMS reimbursement under CPT code 97610. The company has a classic razor blade model of selling a system and then a disposable applicator for each procedure, and its products are sold into hospitals, physicians' offices, wound care centers, mobile wound care providers, nursing homes, and skilled nursing facilities. Although sales can be lumpy, the growing installed base has driven a steady increase in consumable sales, which generally represent 55 to 65% of revenues, and the business grew revenue 60% in 2024. The company underwent a significant capital restructuring in October of 2024, consummating a note and warrant exchange, a $10.3 million PIPE transaction, debt pay down, and a reverse stock split. So as a result, the cap table is now clean and the company has under 9 million shares outstanding. Also, Sanuwave has been profitable and cash generative and aims to continue paying down debt from operating cash flow going forward. So before we get into the presentation, Morgan, it's not often you see kind of the investor fund manager turned chairman CEO. So I'd love to just maybe get some color on that. Can you walk us through some early career experiences and how you ended up running the show at Sanuwave?
Yeah, sure. So I guess my business partner, Jeb Besser, and I founded Manchester Explorer Fund together back in 2004. So we've been doing this together for 22 years. We're a highly concentrated sort of activist fund. We specialize in life sciences. We like to take large positions, like kind of between 10 and 40% of the equity of the companies we get involved with. And so, we like to be sort of long-term, hands-on investors, not usually quite this hands-on. So, but this one is sort of special. Our fund led the recapitalization of Sanuwave back in August of 2022. And I became the chairman of the company at that time, and so started to kind of get my hands in, get a look at what we had, and then by sort of the middle of by early 2023, I think the board had started talking about we need to make a change, and ultimately I stepped in as CEO back in May of 2023. So, it's been, I guess now it's been 23 months. Time really flies when you're having fun. And so, I mean, it was really from the beginning kind of what do we have here? What do we need to do here? Like, what needs to be fixed? And so we really just went through and sort of, it was sort of a to the studs renovation. I mean, like, we really rebuilt the company kind of from the ground up. Like, I think we've I think 70% of the people at the company now are new since I started. And so we've become a very different company. And I mean, it was really just a function of how do we make the company work, so that it can take advantage of the opportunity that it has, and how do we clean up the cap structure so that the company can be valued for its business, rather than the complexity of its cap stack.
All right, excellent. I appreciate that and looking forward to getting into a little bit more detail. So with that, I will hand it over to you, Morgan, to go through the presentation. As a reminder to listeners, feel free to post your questions in the Q&A box by clicking on the bottom of the screen. And Morgan, the floor is yours.
Okay, well, you've already read the safe harbor, so thanks for that. Those are always a joy. We have one too, but you've covered it. So, this is really, I think, you covered some of the key obvious early highlights here, right? Like Sanuwave is a really interesting situation in that it's really very rare. I've been doing this for, I guess, almost 30 years now, and it's very rare in my experience to find a market this big with this much white space. And like wound care is sort of stunning that way. And so we're past the early hurdles, right? Like the company's commercial stage, everything's been cleared by the FDA. The next hurdle is always, do you have reimbursement, right? Lots of companies get approved and they say, hey, I have my special thing, let's go to market. And market says, that's nice, do we get paid if we use your special thing? And if the answer is no, it's difficult to get your product started. So we also have Schedule 1 nationwide CMS reimbursement. The reimbursement rates from CMS were actually increased substantially a couple of years ago. This comes at a really interesting time. I mean, wound care is one of these markets that is a lot bigger, I think, than most people realize. It's $45 billion in the US, and honestly, I think that that estimate is quite low. There's sort of a transition going on, I mean, both in wound care and in a lot of medicine at the moment, to a more evidence-based paradigm. They're starting to try to restructure reimbursement around, efficacy and cost effectiveness. And I think that really plays toward Sanuwave's strengths. We have a highly differentiated product. It's backed by an incredibly broad intellectual property portfolio. And it fits together into a really attractive business model. We have high gross margins. They were 77.9% in Q4. 55 to 65% of our revenues come from a consumable stream. We've now started to hit like a real critical mass of scale. We did 32.6 million of revenue last year. That was 60% growth from the year prior. We had positive operating income of 5.4 million for the year and positive adjusted EBITDA of 7.2 for the year. Like I know everybody hates adjusted EBITDA as a figure, but we're using it because the cap structure we do caused a lot of sort of complicated non-cash charges, and so we're really trying to sort of drill down to what was the company's actual cash generation. We give guidance for this year of 48 to 50 million in revenues, which is up 47 to 53% year on year. So this is the market opportunity. It's as I said, it's a $45 billion market. The number of places in the United States that could conceivably use an UltraMIST system is enormous. You've got, now I think it's more like 30,000 nursing homes and assisted living facilities, 15,000 skilled nursing facilities, over 10,000 physician offices, 2,200 wound care centers, a whole bunch of mobile wound care providers that have moved to providing, wound care to patients in the home. A lot of this is really starting to play toward the strengths of UltraMIST. In particular, there's a specific program that CMS is driving that they call Care to the Edge. And Care to the Edge is, we'd like to treat you where you are, as opposed to pulling all of the patients together and treating them in a hospital setting. Like they're doing this to take stress off hospitals. They're also doing it because it leads to better patient results. One of the interesting sort of findings during COVID was that it was never really an objectively great idea to take old people with non-healing wounds and possibly compromised immune systems out of their nursing homes and bring them to the big building full of sick people and hope for the best, right? Nosocomial infection has become a very serious issue. If you got methicillin-resistant staph infection in a diabetic foot ulcer, you now have a $500,000 to $900,000 problem. And so avoiding a few of those winds up making a big difference. This actually led to a change in the places of service for which Sanuwave's reimbursement codes were eligible. Nursing homes, skilled nursing facilities, assisted living facilities, and patient homes, all got added just a couple of years ago, and that's really made a big difference in the market. This is the system itself, and one of the reasons that this works really well for a care to the edge sort of world is that it's a very small, compact device, like very portable, weighs only 7 pounds. We have a charming Pelican roll case that you can buy to take it around with you so that you don't jostle it when you move. It's a very easy product to learn to use. It can be performed by an MD, by a nurse, by a physical therapist. It works on most forms of wounds, and you can teach someone to use this using tele instruction, in probably 30 minutes. It's a very effective treatment. Reduces wound size, speeds healing, causes almost immediate reduction in experienced pain. It kills bacteria. It reduces biofilms. It promotes blood flow to and revascularization of wounds. You can actually measure the increases in, fibers and collagen and, the actual perfusion around the wound. So, and it's a simple procedure, right? It takes 3 to 20 minutes. An average procedure is about 6 minutes. So, this really helps because as you get out toward the edge, you're off, you don't need to be the same sort of specialist to operate this device that you would be for, many of the more traditional wound care treatments. So, this is sort of the virtuous cycle, right? Where you generate evidence, this gets you the reimbursement, this gets you the usage, this gets you better outcomes. This in turn gets you more evidence, right? And so it's been great to get out in the field. It's been great to be doing, to become one of the products that's actually doing an enormous number of treatments. At the end of the day, I think when you look at, these markets, there are really 3 core constituents who you need to be thinking about. Because we are super creative, we call it the 3 Ps, the patient, the physician, and the payer. So, here's sort of how it works, right? The payer wants to save money, right? Like this sort of primes the pump. Like if you want CMS to reimburse it, their question is always why, right? Why is this a good use of money? Why is this a good treatment? How does this result in better patient outcomes and cost less money? This is a study that was done in the intensive care unit at the Mayo Clinic in outside of Minneapolis. It was a study done on deep tissue injuries in ICU patients. So deep tissue injury is, a hospital contracted deep tissue injury is very common in ICUs because patients tend to be prone, they tend to be immobile, they lay in bed, you get those sort of big, nasty purple pressure bruises where your skin starts to denature and, left alone, those wounds can go really bad in an immobile patient, particularly one whose immune system or otherwise or health otherwise is significantly is significantly like challenged. So they did a 2-arm study, right? One was UltraMIST, one was standard of care at Mayo Clinic. The patients that got standard of care, 70% of those patients progressed beyond a Wagner stage 4 to a Wagner stage 4 or beyond, right? At a Wagner stage 4, is a full thickness wound. Like you don't have any skin left. You can see the underlying structures. You're looking at bone, you're looking at muscle, you're looking at tendons. These are serious wounds. You are likely going into surgery. You have the potential of loss of limb and loss of life. 80% of patients that got UltraMIST resolved at a stage 2 or less, right? So that's a partial thickness wound. So you're talking about something that sort of looks like a bed sore. And 80% bed sore versus 70% bone deep was sort of a no-brainer. And like this is kind of how we became standard of care there. Like the cost drops dramatically. The heal time drops from 16 weeks to 8.2. And these are just wins all around in the hospital, right? This also sort of ties into patient outcomes, right? Because the patient really just wants, what the patient wants is to get better. And the patient wants wound care not to be awful. And frankly, a lot of wound care is. It's easy to, when you hear a term like sharps debridement, what that basically means is I'm taking a sharp thing and I'm scraping around the edges of your non-healing wound to take out the necrotic tissue. That's a very painful process. The fact that you can do this on a non-contact basis with UltraMIST completely pain-free is a very different experience for the patients, particularly as there's an immediate reduction of pain afterwards, which is also not the case of most forms of debridement. So you're getting pain-free debridement, you're getting more rapid healing, you're getting a reduction in pain. Like the patients actually come and ask, like, when's my next UltraMIST? And like that's a very uncommon outcome in the wound care space. Obviously, the physician is the other person at this table. And the physicians obviously want their patients to get better, right? They went into this because they care, but they also want, physicians are running businesses, and they want to know what's the model that's attached. Do I get paid for providing this treatment? What's the model associated with it? As you said, this is reimbursed under code 97610. We're really the only company that has clinical evidence that demonstrates it can be used in a non-contact fashion and bill this code. The code itself lists our product and its precursor by name. The reimbursement runs from $400 to $700 a procedure. That's up from more like $170, $180 a few years ago. I think the average nationwide is about $420. It's this is for a 3 to 20-minute procedure, averages 6 minutes. That can be done by a nurse practitioner, physical therapist, or doctor. Each procedure uses a consumable. Our list price for that consumable applicator is $100. But so this puts you in a position where even after you've paid for the consumables, it's about 85 procedures to pay for the device, right? So, that's this is our, these are sort of our economics. We sell the system for $35,000. We sell the applicators for $100. Those are both list prices. I think there are, at this point, somewhat modest discounts experienced to those. But, this generates sort of a, high 70s blended gross margin for the company as a whole. And so that's really where, that's really sort of how the ecosystem works. And, it then really becomes a question of who are the best customers for this product? Where do the incentives align most closely? I think we've started having a great deal of success in the nursing home and the skilled nursing facility space. It just, the fit is sort of natural. The patients are there. It's easy to give them a treatment 3 times a week, which is optimal early on. The nursing homes themselves find that if they have this capability in-house, patients that were otherwise quite expensive suddenly become some of their most profitable patients, because you do get paid more to have a diabetic patient, to have a patient with venous leg ulcers, but obviously it's because it comes with a downstream set of ongoing costs. If you can mitigate those inexpensively internally, the actual reimbursement on the product becomes almost a secondary concern. It also really helps the nursing homes with their occupancy rates, because when a patient gets a bed sore or a non-healing wound in a nursing home, they often have to be sent across the street. You're sending them to the hospital, but if you can treat them in the nursing home instead, you're not losing your patient. Better still, if you can treat them while it's still a bruise and before it becomes a bed sore, you get better patient quality of life, happier patients, and you avoid having the bed sores, which have an effect on your CMS quality score and could reduce your reimbursement across the board. And so I think, we're finding a really keen sort of set of alignments there, and have started to make a lot of progress in that space. It's become a hot topic, all over all over the world in the last month or so. Let's talk manufacturing. We do not do our own manufacturing. It's all done with contract manufacturers. We have two contract manufacturers that we use to build the UltraMIST device itself. We have another manufacturer that we use to build the applicators, and we are in the process of standing up a second source there as well, because we want to be dual sourced on everything that we do. All of our manufacturers are domestic. Almost all of our components are. Like, we went with some very vertically integrated manufacturers. Like, we don't at this point see any material effect on either our supply costs or our supply availability from any of the recent sort of tariff and trade challenges. We're in the process right now of I guess we started cutting steel back in January on a new 4-cavity mold for applicators. Like, we're making a small change to the way that they're assembled so that we can remove a couple of complicated ultraviolet UV cure adhesive steps from the assembly process and replace them with things that are faster and easier to automate, so that we should get easier assembly, better quality, and lower cost. I think we're hoping to be live with the new applicators in Q4 of this year. That should push the margins on those applicators up several points. As of kind of last month, we had about 10.5K applicators a week production capacity. We're aiming to be more like 24,000 by the end of the year. And on the system side, we're making somewhere on the order of 25-ish systems a week. To a certain extent, we got sort of lucky in that I had pushed the ops team to be able to go to our contract manufacturers and to double that production number within a 60-day period. And to do that, we actually stockpiled some of our long lead time components, and so we're actually sitting on quite a lot of inventory, both systems and components right now. And so we're in a great spot. We don't really foresee any impending disruption. The company used to also sell a shockwave product called Dermapace we sold it into the orthopedic market as well. That was called Profile. That has sort of faded as a contributor to our revenue. So UltraMIST is now up to sort of 99% of our revenue. And so we've really, for all intents and purposes, become a one product company. You can see from the graphs that we had consumables have been on sort of this nice steady growth trajectory. I think they do exhibit some seasonality. It got I think last year it also coincided with a price hike, and so it was a little bit muted. But Q1 is always a little bit Q1 is always a bit of a step down from Q4 in wound care. You can see it on the system side. But when you look at these things year on year, you can start to see the growth rates. We had an all-time record quarter in Q4 of 10.3 million of sales. We ended the year with 1,047 systems in the field. Of those, 135 were sold in Q4. 374 were sold in 2024. So 36% of all UltraMIST systems in the field were sold in the last 12 months. And this still has us at less than 1% market penetration. So, this is the sort of, I think when I took this company, when I took over as CEO, Sanuwave was definitely what I think could be charitably described as a show me story. And so, what we've really tried to do over the last 23 months is to put some stakes in the ground and say, look, this is what we're trying to do. This is our, this is our forecast, this is our model. Let just pay attention, come back, see if we do it, and like let's see if we can build up some trust. We've given guidance for the last 6 quarters, and we've made our guidance 6 times. That's led to, you can see this sort of steady growth here across Q2, and you can see, I think, perhaps more important, the growth in operating income and in adjusted EBITDA. That's something that we've found that we wanted to take this company to a footing of profitability as quickly as we could. Like I really believe in that sort of old school GARP, growth at reasonable prices model. And I think it's important as well for our customers. Like we've reached a point where we're beginning to engage with significantly larger customers. And this is good and it's bad, right? I mean, it used to be, wow, we sold 4 systems, that's exciting. And now, we're talking to customers that could buy 400, and obviously that's a lot more exciting. It's a much longer close. It doesn't all happen at once. It tends to come in sort of lumpy bits. And that's why we've discussed the sort of pigs in a python thing on past quarters. But ultimately, one of the things a customer like that will look at you and ask is, okay, if I'm going to commit this kind of capital to buying your systems, demonstrate to me that you'll be here in a year or two to sell me applicators. I'm not going to make this investment unless I'm confident that, I have a long-term partner. And so, one of the best ways for us to demonstrate that is to sustain, consistent profitability. We had guided to 8.4 million to 9 million for Q1. I guess as many of you probably saw, we pre-announced a couple weeks ago, and the number will be between 9.1 and 9.3 million. So we came in, a bit above the upper end of that range. And so, I mean, just in summary and sort of classic, tell them what you told them. I mean, like this is a huge market. It has an enormous amount of white space. We're seeking to align the incentives of patients and payers and providers. And, there's really just an enormous amount of opportunity here. And, people ask like kind of what gets you excited? Like what gets you out of bed in the morning? Like why is this, how's this a passion project for you? And I now have sort of a really interesting answer, which is, kind of as the old saying goes, like it's all fun and games till it's your favorite uncle who's got a Wagner Stage 4. This is a little gross, but welcome to wound care. Can you guys see this? Are you able to see the wound?
Yep.
Okay, so this is actually my uncle. He had a systemic staph infection. He wound up in the ICU. This wound on the left-hand side is from a surgery. They took a necrotic mass out of the back of his hand. He was at a top hospital in Florida, and this was being treated by taking a ball of gauze, dipping it in antiseptic, putting it in that hole, covering it with a bandage, wrapping it in ACE. The plan was, yeah, we'll give it 3 or 4 months. The swelling will come down and we'll be able to do surgery on it, close the hand, and, he'll probably get a lot of his hand function back. I predictably took sort of a dim view of that. And like, we brought him home and like actually had him treated with a mobile wound care provider using the UltraMIST system in his own house. You can see this sort of rapid progression here where, you had 5 treatments and you can already see that, we're granulating tissue in the middle of that wound. By sort of 3 weeks later, you can see it was still needed a bandage, but it was mostly closed. And by March 28th, about 6 weeks in, like the wound had closed and no longer needed a bandage. Like this was healed entirely with UltraMIST in 6 weeks, pain-free, didn't result in scarring, and he's already rapidly getting full use of his hand back. And so, that's yeah, people always want to ask the question, like kind of what's your key competition? And I mean, the key competition is that, like, the key competition is, wound care the way it was done in your grandparents' time. And, that's an enormous, changing that is an enormous opportunity. And I think that's what gets us really excited about this. We have a great team now. We have an experienced, focused sales force, an experienced, focused commercial operations team. We've expanded our manufacturing, we're expanding our capacity. We have a really capital light model that has a lot of operating leverage. And so, that's our focus, is just going forward. How do we drive, rapid and profitable growth? And, how do we change the wound care space? Like, how do we convince people that, the way we've always done it isn't good enough? And, that's the company's mission.
Excellent. Thank you very much for sharing all that. There's some great color in there. We'll enter the Q&A now. So as a reminder to participants, if you have a question, please feel free to enter it at the bottom of the screen. I'll kick off the Q&A. So lots of interesting stuff to talk about, but maybe a good place to start is kind of the obvious low-hanging fruit question up front. So how exposed are you to sort of stroke of the pen risk or disruption to your reimbursement codes? Or if not, can you just talk about how that might be a tailwind for you moving forward?
Sure. Well, so, I guess obviously anything that's reimbursed by CMS can always be changed, right? I mean, that's just a base fact of like living in a reimbursed world. I mean, the most recent movement on our code was, the most recent significant movement was up, right? I mean, they tend to make little annual adjustments and like chisel things a couple of percentage points, but that tends to happen across the board to everyone. I mean, the best thing that we can do overall to protect our reimbursement, and we have some outside companies that we work with on this and that we've started to work with more aggressively, is to demonstrate that the product works, like to show. So what CMS wants to see is, are we getting good value for money? Is your product effective? Is it cost effective? And so we've been reaching. I think Sanuwave's now reached a point where the company is well enough funded and stable that we're starting to be able to collaborate with some of our some of our bigger, more sophisticated users, and saying, great, let's gather some data, let's put some papers together, let's present some things at some conferences, let's make some posters. We'll have a couple at SAWC, which is coming up end of the month, and then it becomes a question of do we want to do these sort of phase 4 retrospectives? Do we want to get back in the clinic and demonstrate a few use cases? I think there's some strong reasons to look at both. We actually I can't really discuss what it is, but we just started looking at a new indication, and it's one of these things where it's like, only in wound care, where, it turns out there's like a $2 billion opportunity that I'd never heard of before 2 weeks ago. And so, we're starting, I think that's something we probably need to do a little bit of clinical work for, but that shouldn't be overly difficult. I mean, the other thing you can do to, I think, keep your code safe is to prevent abuse. And the nice part is that we have an extremely limited code. It's very specific. There's really not, it's not a code that other folks are using. And to the extent that they are, we can sort of police it and say, should you be using this? Should you be using this code? What we want to do is sort of keep it clean and keep it down, and just keep demonstrating that the product is good value for money. And I think if you can do that, your code winds up safe and getting the sort of pricing increases and, place of service extensions that we've been getting. But I mean, there's really, obviously CMS is CMS. Like there are, you can never say anything with 100% surety.
Excellent. Thank you. And you talked about kind of you're scaling nicely, obviously. You talked about hitting kind of an inflection point in terms of where you feel you are now. I'm curious if you can just talk about maybe um, sort of the things that benefit that scale or how you're expecting to kind of move forward here. Maybe you can get into the sales process a little bit and the success you had in 2024 with a limited amount of salespeople. Anything around the strategy would be interesting to hear.
Yeah, sure. So, I mean, we started 2024 with two salespeople. We have, we are mostly, which is interesting because we're mostly a direct sales model. We do use some distributors, but most, the bulk of our sales are generated internally, right? By the end of the year, we had ramped up to 9 salespeople, and we'd started to experiment with kind of a different sales model. And I think we're increasingly focused on what is a more consultative sales model where we're trying to really partner with the customer to build like long lasting partnerships. It's a bit more complex a sale on the front end. It's a type of sale that I think lends itself to a somewhat different sort of salesperson. Like we've started hiring folks who are more experienced, more senior, who come from sort of higher ticket medical device sales, and who to kind of use med device sales parlance are, more used to selling in the carpeted sections of the building rather than the sections that have tile, right? Like we're selling to the CFO, the COO, the CEO, as opposed to the therapy group managers. And so, it obviously once you're a bit bigger, once you're a bit more successful, once the company looks a little more stable, it certainly gets easier to attract people who want to work for you, right? Like it's no longer, oh my God, like what is this wild risk I'm taking with my career? It's, oh, it looks like I'm joining something that's growing rapidly and makes money. And like I believe, this looks like a safe career choice over the next couple of years. And so, that has helped. We've been turning over some folks in the sales force to sort of better pursue this new philosophy. I think, as many of you probably saw, we hired a new head of sales at the beginning of this year. He came, very highly recommended. He's actually sort of the protege of one of our board members. Jeff, our board member, used to be the head of sales at Abiomed. Tim, who we hired, was his number two. And so, these were kind of like the two guys who took Abiomed from, 0 to 400 million of sales. And so, we're excited to be getting the band back together there. And then we're sort of mating that with, Nancy Gilmore, who's our chief commercial officer and who brings just an enormous amount of experience sort of figuring these markets out, realizing where we want to be, segmenting it, getting all of our kind of sales priorities teed up and really sort of keeping us organized and focused on like, the important opportunities and the places where we can really build, long-term business partnerships. I mean, a lot of this was sort of her brainchild, and so you know, that's really been our focus. I think we are going to continue hiring. We ended Q1 also with 9 salespeople, though 3 of them are different than the people who we ended Q4 with. And then, I think we are probably going to hire another 3 or 4 as rapidly as we can, and that'll actually kind of finally get us to having full national sales coverage for the first time. We're starting to actually for the first time stand up a concerted marketing effort, getting out to a variety of conferences and symposia and like getting in front of people, like helping them understand, what UltraMIST is. I mean, one of the biggest, I mean, I guess the two big hurdles when you start off are, people say, like, I'd love to get to a point where the first question in a sales pitch isn't what's an UltraMIST, right? It would be great to be at a point where, you actually have some mind share in the industry. And I think we're starting to reach that tipping point. We're starting to get, the referral sales where people say, hey, I know someone who used this. Like, how do I get one? And then, the other, the other sort of key tipping point is how do you engage with, the bigger, more sophisticated customers who, aren't going to say, wow, I can buy four, but customers who can, I mean, we're now engaging with customers that could buy several hundred systems. I mean, we're still learning how to do that. It's obviously a longer sales cycle. They tend not to all start at once, but I think we've now put a team in place that's got a lot more experience with that sort of customer. And it just becomes a question of, I mean, we sort of internally call it the elephant list, and we sort of have to learn how to close elephants.
Excellent. That's helpful. Thank you. Great. I will turn it over some of the Q&A to Sebastian. And Sebastian, the floor is yours.
Thanks, Adam, and thanks, Morgan, for the great presentation. So maybe my first question would be around the kind of the competitive landscape in the wound care industry, especially regarding your clients, what they are using before they become clients, and maybe even if there's a difference between, say, a smaller nursing home that you have been working on or closing in the past compared to maybe a larger nursing home in that regard.
Yeah. So, I mean, it really runs the gamut, right? I mean, obviously, there are lots of things you can use to treat wound care. Many of them are differently suited for different sorts of, for different sorts of applications. Like hyperbaric is, the hyperbaric chambers, like high pressure chambers to drive extra oxygen into the wound are, I think this was sort of a hot thing years ago. I don't know that it's a huge part of the wound care or as big a part of the wound care landscape anymore. They take the procedures themselves take hours, like they have to be done in a very specific setting. There are some questions about just like how much, just how much efficacy there is. You've got negative pressure where you're putting essentially like a vacuum over the wound and keeping negative pressure on it while it heals. I mean, this is a modality that shows some efficacy. It's difficult because you literally have to have, something over the wound providing a vacuum for, weeks, sometimes months on end. And so, these are other ways to treat wounds, but like we don't run into them a ton. It's not usually, oh, we're going to use this or we're going to use UltraMIST. We're actually quite complementary with some of the treatments like skin substitutes, right? That tends to be some of the mobile folks like tend to use both. Like they like to use UltraMIST and they like to use the skin substitutes. I mean, honestly, like the thing we wind up competing with most is sort of, what happened with my uncle. It's really kind of like, this is how we've always done it. We're treating this with, antibacterials, antimicrobials. We're treating this with sort of gels and salves and bandages. And that's been, that's really still the preponderance of wound care. And I think, the question is why? You sort of have to convince people like, why are you doing this? And you know, it takes a little bit of doing. I mean, when I first heard this whole pitch, I looked at it and I was like, this sounds like a magic phaser gun. Like, I don't believe you. Like, does this thing actually work? And once you sort of dig into the actual like methods of action, it's fascinating. And I mean, you can really see it and the functionality. And so it really becomes like our biggest competition at this point is kind of that, nobody knows this is a thing. Like I'm sure at some point the market gets sufficiently saturated that it becomes more challenging. But when you're sitting at 1% market penetration, like it's just not like there's an awful lot of white space here.
Yeah. And I guess if you're selling into your customers, obviously first you have to make sure that they buy the product, but then also that they use the product because you make
Mhm.
a lot of revenue with your applications. So how do you make sure that once you get into, say, a nursing home or wound care center, that they actually use the product to an extent that you make enough
Yeah.
revenue?
Okay. So yeah, that's a great question, and it's something that we've actually been doing a lot of thinking about and sort of evolution on. So, we sort of split up our commercial team into a commercial operations group and into a sales group. And, we're starting to kind of create this steady cadence of sort of constant check-ins with customers. And, one of the best ways to do it is to say, hey, here's a new thing. Like, so and so had a poster at this show on a thing you can do with UltraMIST. Have you ever thought about using it this way? And that's a very nice kind of positive way to engage with the customer, get a sense of what they're doing. We have within the commercial ops group like a set of people who specialize in this and who can look at, what are the wound care codes that are being billed in a facility. Which of these patients look like they could be applicable to us? We can come in and say, hey, have you thought about using it here? Have you thought about using it here? And start to drive, like a lot of it really comes down to sort of creating we're really starting to try to create kind of a curriculum for ongoing education so that we can work with the customers and say, these are the things you can do with an UltraMIST. Like this is how to, these are the applications for which the product is well suited. These are the applications where you should probably think about using something else. And that becomes an effective way to kind of keep front of mind and to help your patients understand the new applications they can use it for and to maximize the ones they have in front of them. I mean, more often than not, when we get a chance to really sit down side by side with a customer and say, let's look through let's look through your patient data. We can usually find things and say, hey, this might have been a good idea. This might have been a good use. This might have been a good application. And so, bulk, we've added more staff to that group as well. And we're really trying to up the number of touches we have with our customers.
Okay, okay, great. And maybe this should have been my first question to start kind of chronologically, but I guess one thing that maybe some investors would wondering is, okay, you obviously are growing tremendously. The product seems to work, the customers seem to like it, the payers, the physicians, everyone seems to be happy. So I guess UltraMIST was acquired by Sanuwave in 2020, if I'm not mistaken.
Correct.
Why has no one before you took care of it, so to speak, ever be able to really extract this kind of potential of this product? I guess
Yeah.
Sanuwave before had kind of a difficult financial
Yes.
situation, but also the company they acquired it from seemed to not have done that much with it, albeit
Hmm.
being that most studies, I guess, on
Yeah.
Ultramis are, I don't know, 2014, 20, so kind of a bit
Yeah.
older. So yeah, what is your take on that or your
Yeah.
opinion?
So I mean, this is always one of these, like the answer is it's sort of complicated. The original, I guess UltraMIST was originally created by a company that was very much a kind of for engineers by engineers affair. And they built an excellent product and they brought it to market and they said, you know, why? Well, now the world beats a path to my door, right? And it turns out that it doesn't really work like that. And you need, I think it's a very common thing that happens in medical device where you bring your product to market, it doesn't have reimbursement, and you're going to spend kind of 2 years sort of plowing a trough with your face before you get any traction. And they were not that well capitalized. They wound up in trouble on that, and it wound up getting sold to another company who, again, I think was very thinly capitalized and sort of wound up in trouble. And so that wound up getting sold to Cellularity, Cellularity's focus was not on UltraMIST. They were predominantly seeking to be, I mean, they were like spending hundreds of millions on like a bunch of phase one biotechnology. And so this was sort of their, this was sort of like their odds and ends piece that didn't fit, and they really weren't focusing on it. And so, when we acquired it from them, I think the product had just been, it had been at a bunch of thinly capitalized companies, and it had been sort of backburnered, and it was just kind of everybody's, it was sort of everybody's, it slipped through the cracks product. And then obviously Sanuwave acquired the product in August of 2020. Um, as I'm sure people remember, the times COVIDian were a difficult time to grab a new product, take it to market, and launch it, right? Like that was a very challenging time to go out and to try to sell into doctors' offices or even get into a nursing home. And so, although interestingly, it, I think wound up setting the stage for what's made the company really get traction since, right? Because that's really where Care to the Edge caught, got traction. It's where a bunch of the things that people had wanted to try were suddenly forced on them, right? It wasn't, hey, what if we treated people in situ in nursing homes? It's, hey, we have to, right? We're doing this now. Necessity becomes the mother of invention. And, it all got tried for a couple of years. And it turns out that everybody liked it this way. It worked better. The patients got better care. The nursing homes had higher patient satisfaction. The everybody was, the physicians there were making money. The payers were saving money. And so it wound up really we're kind of working out for everyone. And so, in the time since Sanuwave has owned the product, the reimbursement was increased from 120 to 180 to kind of the 420 average that it has now. The places of service were expanded from just being doctors' offices and hospitals and wound centers to also including nursing homes, SNFs, assisted living facilities, and patient homes. And so, kind of a lot of stars have aligned here over the last 2 or 3 years, and it's really, it's created the ecosystem in which the product can really thrive.
Yeah. Okay, perfect. Maybe now moving to the financials. I think in Q4 you did achieve the highest gross margin with 77.9%, if I'm not mistaken. So
Hang on, I'm
what
going to pull up my cheat sheet. Yeah.
So what kind of drove this gross margin improvement? I also think if you calculate kind of the sales you did with the system revenue, that you increase or sold at the higher average price than the prior quarter. So what was this the reason for the higher gross margin? And yeah, how should we as investor kind of think of the gross margin moving forward in the next quarters and years?
Yeah. So I mean, if you look at, I mean, system pricing in Q4 was very similar to system pricing in Q3. So nothing like it was the change in gross margin was not driven by pricing on the systems. It was actually driven by better costing on the systems. Like we stood up two new contract manufacturers in Q3, and it made the systems themselves lower cost to manufacture. So, that's part of what drove it. Another thing, I mean, one of the things that will affect our gross margins, you know, in well, that affected our gross margins in Q2 and Q3, that will have some effect on some of the gross margins this year off and on is NRE, right? Non-recurring engineering expense. And Q4 did not have a whole lot of non-recurring engineering expense. And so you were sort of getting like the first clear look at the new pricing with, the new manufacturing cost structure. You will through some of the quarters in 2025 see some NRE run through, as we pay for, standing up the new lines around applicators. Like it's not going to be massive. It's not going to be, especially material. I mean, it might, you might see, I don't know if we'll be able to manage, I don't know if we'll be able to keep this sort of almost 78, but maybe you might see 100, 150 bips of, sort of variance quarter to quarter as we run some of these things through. Some of it's like we're seeking some accounting guidance on it. Some of it depends on how much we can straight line it across, the year versus having to actually expense it as, as incurred. And so, but it shouldn't like the Q4 was a pretty clean look at what our gross margins look like without any sort of one time.
Okay, perfect. And then now moving on to your debt, I think you still that's kind of the one thing that is still there from the kind of messy past of the company. So how do you obviously you reduce especially with the note exchange, but you still have some debt. So what is the plan there? Maybe to refinance it or to pay it
Yeah.
off?
Can we
So I think
also, sorry to interrupt. Can we also throw in the IP settlement discussion into that debt question as well? Thanks.
sure. So um okay. From a debt standpoint, we have about 27 million of term debt, right, outstanding, and that we are currently looking to refinance. That debt was incurred at a time when the company was on a, shall we say, much less solid financial footing. The interest rates on it are high. I think we can probably cut them very significantly by refinancing. We've waited to do that because we wanted to get the numbers from Q3 and Q4 out. Those are, I mean, they showed a pretty material change in the way that we generate, EBITDA and operating margin. And so, that lets us sit down with a different sort of lender. And ultimately, one of our goals in a lender is we want to be able to pay this debt back. We believe that we can pay it off out of cash flow over the next 18 to 24 months. And that's certainly our target. I'd like to take the company down to being debt free. One of the things that may help us in that regard, what Adam so I don't know if people have focused on this. We haven't really talked about it a lot, but so we have a partnership with a large intellectual property assertion firm. Like I can't name them, but you'd probably know their name if I did. And it involves some intellectual property associated with our old Shockwave product line in a cardiovascular application that has nothing to do with any product that we ever manufactured or will likely manufacture. And essentially, we did a deal with them last year where they paid us $2.5 million. That gave them effectively an option. They can exercise that option by making sort of a mid-single digits millions cash payment to us. That then takes all the, that then puts all the IP into a special purpose vehicle from which they can go and assert it. So, they'll make that payment when, they're getting ready to go do assertion. In the event that that assertion is ultimately successful, they recoup their costs and there's sort of a waterfall share on the back end. So in the event that that payment drops, we'll immediately use it to pay down debt, right? Because we're now at a point where we're not, where we have enough cash to run the business. Like we don't need to be feeding money into that. And so it becomes a question of let's take out the debt, let's get it out of the way. I would love to be able to just get this stripped down to be kind of a bone simple cap structure of, 8.6 million basic shares. And we have a knoll in excess of $200 million. So that would imply we're not paying taxes anytime soon. And once you get all the debt paid down, it starts to make your kind of adjusted EBITDA numbers and your net numbers look awfully similar, or at least your cash flow numbers look awfully similar.
Yep. And I guess the next question is kind of how many years your IP is valid and where you see the company in next 2 years. I would maybe add to that maybe not only 2 years but 5 years. I think it's maybe to have a larger time frame as well.
Yeah. So the intellectual property has like obviously it's always a rolling, function, right? Like, and many of the patents date back some time, some of them, including a couple of the sort of broad, use applications and technology patents around UltraMIST are, recent within the last couple of years. And so, those have almost their full term to run. It ultimately becomes a function of, continuing to add to the patent portfolio and of continuing to innovate and add things that can be patented to the portfolio. So you ask kind of, where do you want to be in 2 to 5 years? We're starting to give some very real thought to what the UltraMIST 2.0 product looks like. I don't know that we're quite ready to talk about it yet, but it's, we have some thoughts on how to make it easier to use for the clinicians, stickier for the clinicians, like more effective as a wound treatment modality. And I think, perhaps most important, able to generate lots and lots of very high quality wound treatment data. Because, ultimately, the best defense in these markets long run is, I mean, there used to be that expression, like, nobody gets fired for buying IBM. And like, you can get, you can reach that point in a market. It's sort of like a Metcalfe's law moat where, because you're big, you get to stay big, right? Why does everyone use your product? Because yours is the product that has all of the really good data support. Why do you have so much data for your product? Because everybody uses it. And, that becomes a very virtuous cycle. And it creates an interesting moat where, any new product in whatever space that wants to compete, first has to sort of get over the hurdle of, we have lots of data that this works. Like, why should I trust you?
Yep.
And so I think that's really going to be, you know, like, I mean, this has sort of been like a play in three acts, right? I mean, 2022 was kind of, how can, like, let's see if we can dig this thing, let's see if we can dig this car out of the mud. And, or sorry, 2023 was sort of, let's dig this thing out of the mud. Like, last year was, let's take it apart, let's put it back together again, like, let's make it run well. And now we're starting to really be able to say, okay, let's take this thing out on the track and see what it'll do. Like, where do we want to take it? And, these are questions that I think the company hasn't really had it hasn't had the luxury of asking, right? It becomes sort of like a Maslow's hierarchy of needs where, like, nobody who's worried about where they're going to get their next breath of oxygen cares about what's for dinner, right? But like, once you're confident that you have access to air and to water, like, now what's for dinner becomes a really interesting question. And I think, we're entering that stage of our corporate cycle. I mean, when you ask where do I
Uh,
want to be in 5 years, like, I would legitimately like, I would legitimately like mist to be a verb. Like, I would like the industry to say, oh yeah, I missed it that. Like, I would like everyone to know what that means.
Great. Yeah, I have another question or two, Sebastian, if you want to ask another one, or I can continue. It's up to you.
Go ahead, Adam.
Great, thank you. Yeah, so just in talking about kind of, you had just talked about your vision the next couple of years, where you'd like to end up. As you think about growth this year beyond, what's the incremental contribution margin on growth from here, and how much incremental revenue will sort of drop to the bottom line as you scale?
Yeah. Um, this is actually one of the things I really like about the model here. Like, it's an extremely capital light model. And, as once we get the new applicator design up and being manufactured, like that, that will further aid our gross margins on the applicators and actually sort of push them up, another, maybe 3 or 4 points. And, at that point, we reach a level where, you've got gross margins that probably start with an 8. And, like that does seem, barring, I mean, obviously, barring mishap, like, and I'm not trying to give guidance here, but like, that does seem like a thing that could be attainable. The, then you've got, the commissions to pay out on it. You've got, the operating costs. and they don't really ramp linearly, right? I mean, once you've got your finance department taken care of, and even you get in the clinic, you do some studies, you've got your operations group, it's managing all the contract manufacturers. Like, there's really no reason why the company shouldn't be able to drop 50 cents of every kind of incremental dollar to the operating line. Like that really should be kind of the sustainable model. And obviously that can really start to move the needle if you can sustain substantial revenue growth.
Excellent. Yeah, well, we're looking forward to seeing how that unfolds over the next couple of years.
I mean,
I think
it
that's
also helps if you're not paying taxes in the next several years because of, I mean, having a like, nulls are underappreciated assets, I think.
very much so. Yeah, very much so. But that seems like an excellent place to wrap it up. Just want to say thank you very much for the time today and for all the color provided about the business. This was really comprehensive. And thank you to everybody who participated and asked questions. As always, we will get the recording up as soon as it's available. And just want to say thank you again to Morgan and Sebastian for the time today.
Yep. Thank you guys. I appreciate it. And we will be down at Planet Microcap in a couple of weeks. So if folks are there, come and say hi.
Looking forward to seeing everybody in Vegas, and that includes Sanuwave. So thanks again.
Thank you.